Hi, Dr. Brotsky here. Welcome to week 16 of your pregnancy. If you haven't checked out the other videos week by week, go for it and do that. Right now, your baby is about 4.5 inches long, so we're seeing a lot of fetal growth and development around this time. What you can expect right now is some people are just at the beginning of starting to feel fetal movement. I have a lot of moms that come in and they're really stressed out because they haven't felt it yet, and maybe another mom they spoke to has, and that's okay. It depends where your placenta's at. It depends if it's your first baby. So what it usually feels like is some gas pain or some fluttering or some just weird muscle spasms sometimes in your lower pelvis. And you may notice it more at night at the beginning, but that's kind of how fetal movement starts. It's very intermittent. There may be days you feel it, there may be days you do not, so don't become alarmed. We don't count movements until later on in pregnancy, but very exciting that you can feel your baby move possibly. The other thing you might notice more of is acid reflux and also decreased concentration. So I think I mentioned this on an earlier video, but start making lists. List questions that you have for your doctor, but you may notice in everyday life that you have to make lists more often. When I was pregnant and I was in residency, I remember having tons of paper with me because I had tons of lists. I couldn't remember anything to save my life. So just keep an eye on that and don't beat yourself up. It's normal. What to expect from your doctor around this time is to possibly get a blood test for a spina bifida screening test. It's called an alpha-fetoprotein. It's just a blood draw. And doctors won't do it if you opted out of your genetic screening, but a lot of the time this is the period where they can screen for that. Other times at the doctor you may have an ultrasound around this period. And that's exciting because we can kind of start to tell where the placenta is located and give you some feedback about that, make sure it's implanted properly. You can also possibly tell the gender around this time. It's a little early, so don't throw away your receipts if you buy anything based on those results. The other thing to start thinking about is sleeping on your left side right around this time. If you exercise a lot, also get off of exercises doing flat on your back. So you want to lean more towards one side or the other and not do that. You also, if you may start progesterone injections. If you have a history of preterm labor, sometimes we'll start those around 16 weeks. So just something for you to be aware of. Most patients do not need that at all. So things for you to look out for right now are intermittent fetal movement in the next few weeks, but possibly now. And your partner will not be able to feel this yet. That's normal. That's not going to come for a few more weeks. So those things are to be expected. Always look out for bleeding and severe cramping and let your doctor know right away if that happens. That's it for week 16. Thank you so much for watching. Check out my other videos, and you can also find me at drbrotsky.com.